Welcome to the In Season Podcast, rated R for language.
None of us are doctors or neurologists. Things you're about to hear are opinions of people living with epilepsy or seizures. These are first-hand experiences. Epilepsy can cause speech problems, and medications are hard to pronounce, so please bear with me. Epilepsy can cause bad memory, so some stories will be repeated. I'm Pookie. Get ready.
I can hear you.
Oh, I can hear you now, lightly. All right.
Yeah, I can hear you now. I was getting things set up.
How you been,
Hi
Reese?
everyone, it's been a while. Things
Yes,
are
it
like
has.
nuts over here. I'm moving and I had a visitor, and so it's just been everything possibly that, it's been nuts.
Gotcha.
I said,
Hey.
Hi,
Look who's
guys.
here.
I saw the disclaimer. Good job. Good job. All I can do is smile. I'm so grateful. He's not wasting any time. But man, this Xcopri, the titration is making me a stronger warrior. Okay. Yeah. So how's everybody doing?
so far so good. Yeah, so far so good. Oh my goodness, my phone.
I feel like I've been away for a while. I don't know if that's true, but that's because I've had a few bad ones. I am moving, maybe that's why, but I had one where I wound up with 2 black eyes.
Oh,
So that was neat. And so I've been wandering around with 2 black eyes. I don't think they're that visible anymore. I think they're almost healed. And I had a couple more since then. So yeah, things are going great. And yeah, thank you.
you look
So,
awesome. I'm
yeah.
sorry we missed the black eyes because you wouldn't show us, but you look awesome today, Reese. I'm happy to
Well,
see.
thank you. Yeah,
I think we've all had.
I had to show my therapist, I think, and who else got to see? I mean, obviously my wife got to see. I felt like enough people got to see. Y'all didn't need to see too.
We
So
love you anyway. We know. We get it. We get it.
I appreciate it.
Yeah. It's good to see you. I've been gone for a couple weeks too. It's like I just kind of crawled into my cave, stayed there for a little while, but trying to get used to Xcopri. We're gonna bring down the Vimpat as soon as my pharmacy releases the prescription because I just filled my Vimpat 200. Now he wants me on 150. And they're like, well, you still have pills left. And I'm like, don't make me do this. I'm just going to call the doctor and let them fix it. So, because I'm not going to fight with anybody, not when it's like, okay, the only reason I'm getting this filled sooner is because it's a different dose. Well, it's a controlled substance. Well, I'm going to exhibit my control. So there we go. I should have that tomorrow. Just went up to 50 milligrams. Angel's at 150. He's way ahead of me. I'm like, oh God, oh this, but I feel better. I do feel different. So in spite of the ick.
I'm glad you feel better. I'm glad you're here.
Yeah, I miss you guys.
Always a warrior.
Yeah.
I was like, Ann will get better. She'll be back.
I'll be back. I'll be back. And I ordered the spinner knob for my lawnmower so I can still ride my tractor and use my left hand when my right shoulder is healing. So we won't tell the doctor, but
Oh, wait,
I'm not telling.
all
Oh,
right, we'll get
but it's
started.
a really good to get off of the Vimpat because Vimpat plus the Excopri. Once you get off the Vimpat and
Oh,
don't have the salt levels, well, you still have salt levels killing you, but it's not as, ugh, if that makes any sense.
yeah, it does because it's the vertigo.
Mm-hmm.
And I did the smartest thing was I share my health information on my phone with my doctor. And he sent me a message today. And he's like, "What happened?" Ah, oh, this is what happened. But I think this is why, because Sunday I was in a lot of pain and I was double dosing on my Feco. And he's like, "Well, cannabis and Xcopri don't get along. And because you're on both the Xcopri and the Vimpat, that would throw you off." So he said, "I'm not telling you to stop using it, but now that you know, you got to be careful. And that pain should go away after this surgery. And that's his number one priority is to get me through that and recovering better. But I can't have vertigo. I can't be dizzy. I mean, I'm walking into the corner of the wall. You know what I mean? It's like, whoa, and wall surfing. I call it wall surfing. It's like I need something to hold me up. I can't hang on to the cane. It's just not, this is not happening here. But definitely getting somewhere and very grateful and happy to name the name Trent Tollefson at URMC Epilepsy Center. Anybody in Rochester, he's the one you want. Okay. He's the one you want. This man is not missing a thing and he's watching me like a hawk. I mean, for him to send me a message, I noticed this at 4 a.m. and how did that turn out? I'm like, oh, I kept a bucket near my bed just in case, because I know, what medication changes can do. And I'm so grateful I did that. And when I described what that was like, he's like, okay, that's my cue. That's my cue to lower the Vimpat because that is what does that. And you'll be better off with either none of it or just a little bit. And the X Copri should do it for you. But this isn't fun. I hate this part. Oh shoot. And they're still bugging me to complete pre-appointment. Blah. All this paperwork for surgery is crazy. But yeah, so that's things are going better. But it's kind of funny. I don't know if you guys know what K tape is. It's called kinesiology tape, and people, especially weightlifters, athletes, will use it. It You stick it on your skin, and when it's done right, and because my daughter's a kinesiologist, she brought home some K tape, and we're going to tape my bicep because there's nothing. It is no longer attached to my shoulder. So we're going to tape it up so that I can still keep that muscle moving because the more it's moving, the more tendon we have. And I'm like, I want to scream. And I'm still doing my exercises and crying. I am literally in tears. And I'm like, I don't care. I need this muscle to move because they have to literally pull the whole muscle up to my shoulder and attach the tendons. So I need that muscle to be pliable. So Natalie is like, I don't think I have any at the studio, but I'll go to Target. I'll get some. So she's going to tape my arm up, and hopefully that will help. Helps with the pain. We've done it to my knee. It's pretty amazing. Physical therapists will do it in certain situations like this, but I'm not in physical therapy right now, so I guess I'm stuck with the next best thing that it's like, yeah, she's amazing. So I'm looking forward to that. That'll stay on for a few days. We'll change it, take it off, and 2 days before my surgery, And hopefully that'll give the muscle enough flexibility so that we can pull it up, because now, I mean, I've got pain. The headache is going up the side of my head. I'm like, 10 days, guys, 10 days. So I was mad cranky. I mean, I couldn't bring that here. But we're getting there.
Are they
Yeah.
going to give you like that tape that they use for athletes, the one that helps like with pain also? It's like,
Yeah, that's K-tape. Yeah, that's
okay,
exactly what she's got. And she's
man.
gonna, it's gonna be crazy because supporting a shoulder that is no longer attached to part of your arm is a challenge. But I don't even know. She said what she was gonna do, and I'm like, I don't care. Just do it. She knows what she's doing. Just do it. But it's like the wrong muscles are working to move my arm. My elbow hurts, my hand. I'm like, I can't. I just can't do the headache anymore. So we're going to try to relieve some of that pain so that when I do my exercises, I'm not feeling like I want to throw up, those spontaneous tears. It's like, no, I am not sweating, just my face. Okay, it's just my eyes are sweating. Okay, that's it. But yeah, mm, I'm not backing down on this, and I know it's funny because Jeff was like, "Oh, this is brutal. You got to rest that shoulder." I don't know how to do that. Okay, I really don't. Um, Especially when the shoulder contains what are called accessory breathing muscles. The only way to rest it is to stop breathing. I'm sorry, but I'm not doing that today. So we'll do the K tape. And there's Jeff. Yes,
Hey
there's
guys,
Jeff. There's Big Jeff. Hi.
Hey, brother Jeff.
how you doing?
Doing
Right.
okay.
So far, so good. How about
Good.
you?
I'm only I've got a day full of meetings. Just finished a meeting and then I have to go to the chiropractor. So I'll be on for a little while, then I'll be on later.
Okay. Chiropractor, you lucky guy. You lucky
Right.
guy. I can't do that
Lucky.
anymore. Yeah, I can't do that anymore. What?
I'm basically going to him to get a script for an MRI for my
Oh,
Mm.
hip.
really?
Yeah, my
Oh,
hip and my one of my my knee replacement is probably dead. So I think it has to be replaced again.
oh, geez. Oh, geez. Haven't done that yet. I've had two
Yeah.
reconstructions. There's nothing
Well,
left
hey,
to.
while we got Jeff here, let's have you answer the first icebreaker. And
Okay.
that is, what do you think makes these meetings productive?
The people.
Okay.
I mean, the people make it productive. Everybody contributes, except me. Um, and uh, everybody's concerned about everybody else. And it's the people that make this special.
All right. Next up is Toaster. What makes these meetings so productive?
I thought you might have forgotten I was here if I just stayed silent. But no,
Never gonna happen.
what makes these productive? Well, I mean, yes, definitely the people, but it's also the stories that you get. I mean, just listening to Annie, it's like, holy shit, if she can do this, I can too, type of stuff. Listening to stories that's like, oh, Pookie wandered off. Oh, yep, I've done that. I don't feel alone. Um, there's actually the I went to get an SEG done once, and there was this guy who had just gotten his resection done, and he was up and walking around, and then every once in a while, nurse would come get him, put him back in his room. Then 10 minutes later, he'd be back in my room. We'd be having grand old time. We were watching the Jimmy Buffett concert. Um, and my mom said, if you had friends who have epilepsy, things would have gone a lot more smoothly. We would have known a lot more because I learn from you guys every day, and it's yeah, it's the stories and the people.
I've had experiences, and I'm sure you guys have too, in the hospital where people don't know things about epilepsy. You know, I've gone for my MRI and people have been like, "Wait, what's that thing in there?" And I'm like, "That's a shunt. They put that in there when I had my fucking whatever surgery where everything went wrong. You don't know what a shunt is? You're the doctor." It,
Oh,
what?
that's terrible.
I don't understand. And like
Was it a nurse or a doctor?
I I'm I don't remember. I'm the one with the neurological condition. I don't remember, but you know, it, it it's we have to teach all of our doctors about our condition every time we meet them. So it's nice to talk to people who already know.
All right. And what do you think makes these meetings so productive?
It's definitely the
Oh, I asked you.
mutual.
Shoot.
What? What's the matter? Oh,
Did I ask you first?
no,
No,
no, I
Jeff went
didn't.
first.
I was
Okay. All
just
right. My
gabbing.
bad.
It
It's definitely the mutual support because we understand each other and we have no doubts that what you're telling us is true. We don't have to defend ourselves. Um, we don't have to prove anything to each other. We can just say, "This is my story. This is what's happened," and we get it because we're part of that story. We've experienced some of it, and then having everybody, literally all I have to do is reach out and say, "Ouch, I need some support." And you're right there. I took a few days, well, felt like a few weeks off. And yeah, but I was still talking to Angel. I was still trying to stay in chat. I stayed off of Reddit because I was definitely being followed. I don't know if you guys saw that new epilepsy group, Focal Aware Seizures. Um, it's an interesting little Reddit that,
Did not see that.
yeah, you should look at it. I think there's maybe, I don't know how many people, 6 people in there, and they have 4 different account names. But yeah, um, so I don't know if it all came from all of that or if there was, I do have a couple nefarious stalkers that I really suspected that's what happened, and I don't know. Um, I don't know. It's just I'm glad that's over. We covered all the bases. This is a podcast. This could be recorded, and I don't know. I guess I thought everybody understood that too. It was just kind of crazy, and
I don't have to say it anymore.
now I know I love that.
Unless you really clicked agree without reading, I don't have to even bring it up anymore.
Yeah, it's right there. You said yes. Okay. That's the disclaimer. Nobody in any state can fight with that now. So it's like, okay, you're being recorded. But that wasn't enough for some people, I guess. I don't know. I don't know. Um, but whatever all that was, I'm glad. It looks like it's over. I don't know about you guys, but I did have some people on Facebook following me around. And I got some weird things happening on my Reddit. I keep getting new account names on my account that I'm not putting there. And I'm like, what is going on? So I don't know how to fix that. Yeah. But other than that, things are fine. But yes, definitely the mutual support, the mutual understanding, the snickerdoodles and brownies.
Uh,
All of that. All that.
what was I gonna say? I was gonna say firstly, I can't find the focal aware thing, but
Okay, let me see what I can find.
and I was gonna also say your name did change a couple times last week.
Yeah,
I couldn't
yeah.
figure out if it was you or someone else. 'Cause
I
I
can't
forgot a few
either.
names.
Yeah, half the time it's like, oh, and it just changed again. It's like I don't even know who I am anymore. But
All
it's
right, that
weird.
focal aware link is in the chat, and I'll be right back.
Yeah.
Unrelated to this group, but I had thyroid cancer, and before you get your thyroid removed, or no, not, it's not before you get your thyroid removed, it's after you get your thyroid removed and they verify that it was cancerous. They have to do this other wonky, I don't even know, radioactive thing. And you have to prepare for that for like 2 weeks with like this crazy diet. And it's not vegetarian, it's not anything specific. It's just a wild diet that everything is out. You basically can't eat anything except vegetables and just like these but only specific kinds of vegetables. It's a weird diet. So you basically can't eat anything. You're just a rabbit for 2 weeks and it's terrible and you're miserable. But I found this recipe where you could make these like shitty, they weren't snickerdoodles, but they were these, I think they might have had peanut butter in them, but they were just these nasty, they weren't cookies, but just like baked something, some kind of thing that I was so excited about because, yeah, imitation cookie. That's a good way to describe it. And they were disgusting. Like any other time, I would have been like, what the hell is this? But during this time, I was like, oh my God, this worked. This came out. This is the greatest thing I've tasted ever in my life. And my wife tried them and she was like, these are disgusting. And I was like, yeah, I believe you, but I love them and they are my favorite thing ever right now. And please give them back to me. And I just think that's very funny.
Okay, love where this one's starting off. Already got plenty of conversations going on favorite snacks and everything. Somebody's saying here, is it weird that I'm smart even though I have epilepsy? Big long story, but that basically sums it up. Just saying that they were going to get checkups every 4 or 5 months, like twice a year. And the doctor always gave them the impression that, expect your mental capacity to decline. And this apparently who posted it was 14 years old at the time and was really not looking forward to that happening. The comments assured them that epilepsy is different for everybody and definitely get a new doctor, I would say, because if any doctor ever gives you the impression that you're not going to be smart because of epilepsy, that's not somebody on your side. Did this ever happen with you guys? What do you think?
This has
No.
not happened to me. I have only had epilepsy for a short time, but I will say I am terrified of this. So, anyone who's had epilepsy for a long time, I would love to hear about not only what your doctors have said, but what has actually happened.
Wait a second. What
I
about Mark? He's brilliant.
We can ask him again when he gets here. What about Toaster?
Um, what I would say is intelligence and knowledge is two different things. Like Annie just said, people tell her that she's smart all the time. She is smart. She's you're smart as you're sharp, real sharp. But there's a difference between smarts and knowledge. And my neurologist has basically told me deep seated, there's soft memories and hard memories. Hard memories of how do I fix or how do I do this? And things of who the hell Margaret Thatcher was. Um, it's two different things. Knowledge and smarts are two different things. Um, and it's often confused because, well, we are all brain damaged. Our pathways are not clear anymore. Definitely not. So we are very good at rerouting, but there's still but the degradation that still happens. Things that you used to know, you might not know anymore, but you're still smart. And guess what? You hold in your pocket this wonderful device. My friend Annie told me about this. It's a supercomputer that you sit on and it tells you the time. It's called a phone. The internet has saved you many times. I mean, many times before. If you just be smart enough to use it. Okay, I'm done.
Hey, Angel.
Yay, I remember to turn off mute now.
I forgot the icebreaker. What do you
What
find
do you
most
think?
productive about this?
What hold on. Let me what I think makes these meetings productive. Well, one is just being around all you guys and hearing your stories and stuff of how you battled through epilepsy and stuff, and like the different things you experienced that I didn't know that was involved with epilepsy that I also experienced, and that was very good. Like, and two is just, I think, sharing it with the world, like getting it out there and letting know that others, you're not alone. And I think that's what makes these things most productive.
Right. I got some right here. Says, is there something I don't know? Okay, so I have a sister, 28 years old. She has epilepsy and she's had it for a number of years now and seems to have a consistent issue with not taking our medication, forgetting to take it now. And she seems to have a consistent, oh, I'm reading the same line, forgetting to take it or right out refusing to take it, which of course results in eventual seizure. At first, she was claiming she was forgetting to take it, which was understandable. Sometimes you forget. I forget to take my medication sometimes too before I leave for work, despite it being my usual routine. Then, then when she kept having them, we kept finding out she wasn't taking them at all, as in she wasn't just forgetting. The reason really was we found out because the medication was not found to be in her system after a doctor performed a test. After that, my mother tried to make sure she took her medication, and for a while that worked. But now my sister has become fed up with being reminded after a few weeks. I walked into the living room and my sister suddenly grabbed my attention. I looked over to her to see what she's holding, two pill bottles in her hands. Looking rather irritated, I was confused, but then she started explaining She claimed that epilepsy and neurodivergency, which I looked up, and I'm unsure of whether that statement is true or not. And she wouldn't be taking her medications anymore because they were eradicating her. It was rather concerning to me, considering epilepsy can be fatal. Sure enough, after refusing to take her medication, she had another seizure just a week or two. I just thought I would share this because I'm curious if anyone else has had this experience with a sibling or another family member or a friend. Please just feel free to tell me. I'm deeply concerned that doesn't start taking her epilepsy medication seriously, that she may not come out of her next seizure. Also, please feel free to correct me if I'm wrong about anything, because there are some crucial information I'm missing here. And I don't know a lot about epilepsy aside from knowing what to do if she has a seizure and the type of seizure she has. They're tonic-clonic seizures, also known as grand mal seizure. Pretty much. What should they do when you have a sibling who's not taking their medication? And that's a shitty day. You got to worry about someone not taking it because they don't want to. I take
And
Sounds
mine.
like on that one.
yeah,
Go ahead, Angel.
any seizure could be your last.
Yeah, I take my medication because I don't want it to be my last.
I responded to that, I think.
Yeah, you
I
did. I was gonna wait until we get other responses.
Okay.
Get to
I
yours.
couldn't remember what I said though, but when you were reading it, it's like I know this one. Okay.
um, we don't have any siblings. We're all the ones having the seizures. But in the comments, someone says our daughter, wife, and I lost our 25-year-old daughter in April 2021 after returning from errands. We found her face down after a seizure that had caused cardiac arrest from the position she'd fallen over. Her breathing was minimalized from that. I'm stating this because after her passing out, we found piles of her medicine throughout her bedroom. We assumed she had been taking them and been taking her pills for months, only to discover the identical situation you're feeling too. Now, being that she's an adult, realistically can't force her to down them down her throat as much as I wish I could. With that, a conversation perhaps discuss the outcome that could resist in this behavior and possibly counseling. Find out why she refused to take it. I hate taking my medication, also epileptic and ADHD and antiphospholoid syndrome. So I take a lot of shit every day. I understand for the most part what she's doing. Though regarding the medication, it is overwhelming. The side effects, the memory issues caused by pretty much everything and every medication that treats epilepsy combined with seizures that also affect memory. It's all cumulative. You love her dearly, and that is beautiful. Yeah.
That's well said. Trying to get to the root cause is the best way to do it.
Yeah, I was thinking, are they asking this person why not? It didn't say if they asked her why not. And another comment says she needs to see a psychiatrist. Or OMG, I'm so sorry. She's convinced herself of something very dangerous. Try contacting her doctor and ask them for advice. And then there's Toaster's comment. It says, okay, let me break this down the best I can. Yep, goldfish memory sucks. I forgot my morning meds all the time before my mom made a sign that says, take your morning meds. I put it out at night when I take my nighttime meds. Then I am unsure if I took the morning ones. I look for the sign. If it's still up, I take them and then put the sign away. If the sign isn't there, I assume I took them. Epilepsy in itself is not neurodivergent, but there is large percentage of those who are. They're also in overlap when it comes to how much stimulation we can take, if and that makes sense. Wait, she's refusing to take them, eradicating her. Okay, some meds do feel that way, make you into a zombie, but why wouldn't you tell her doctor to change her meds? Here, when it comes to when it comes to what to do when having a seizure, seizure safety school. Oh, you linked it. Seizure safety school. Is that a story you wrote?
Yes.
So I don't know if this is going to be helpful at all, in addition to Toaster's comment, but I feel like I already forgot the specifics of the question because I'm still working on my medication, so my memory's bad right now. But there are a lot of things you can do to help remember to take your medication. And there are also a lot of things I wanted to say about why you should take your medication. So, first of all, I have my pill box that is it has morning and night every day of the week. Hold on, my computer's doing something. Okay. We're good. Fill it up every week, take it every day. Then you know if you took it or not. Great stuff. Regarding whether or not they want to take the pills or fill up the pill box, I gotta be real with y'all. I understand feeling like you don't really want to or care. I've been there. I think that seeing a psychiatrist is not something that people should feel embarrassed about. I think that everyone should see a therapist at the very least. That should be a just a general thing. And a psychiatrist should be a thing that people are less ashamed about. As far as people's feelings about whether or not a seizure is the last one they ever have, the thing that brought me to think about it differently was, what if it's not your last, but it's your last as you, if that makes any sense. Seizures affect your brain. They can change your brain's abilities. And yes, any seizure can be your brain's final seizure, but any seizure can also be your brain's final seizure's ability to do XYZ. So when I'm feeling like I don't care, I don't want to deal with this, I don't want to take these pills, I don't want to have a million doctors, I don't want to do this, I just remind myself I don't want to be a vegetable either. That's the biggest thing. So if this is the best that I get, then I'll work with it. That's what I tell myself. That's all I got.
That's the best way to make it through. Still sounds like you're trying to stay positive for the most part.
That's what I was gonna say. Staying positive. the best part about it.
Yeah, I almost forgot my pills until like right before the podcast, and I'm like, oh, I didn't take my morning meds, but I did wake up late, so
I got
So
one here.
Angel, what Angel was saying about these excopiries, since so many people are taking more medications, this new one especially. Has anybody's doctor ever put a plan into effect of like getting a baseline of blood work, just kind of running a TBC before and then maybe 3 months into titration or when once you started the new meds? Toaster.
So I was on the drug trials for Xcopri, and the types where you didn't know if you had the real drug or if you had a placebo. I'm quite sure I had the placebo. Um, because after the trial, they put me on Xcopri, and things were totally different side effect wise. But during the trial, they would have me take blood tests every 2 weeks. They were mainly looking at my liver, the liver, whatever they use for help you figure out what's going on with your liver. Um, but yes, there is a noticeable drop in your sodium intake. Potassium, I don't remember. I just remember the sodium.
How long did it take for that sodium drop to take place?
Well, what now that is the interesting thing, because I was on Vimpat as well, and that one also drains your sodium. So I don't know if it. And I was go- that time was very weird
So you
because
had
I
no way
had,
to pinpoint which pill did it necessarily.
yeah, because during the trial I stayed on all of my other medicines, so they had the right baseline. I wasn't weaned off of Vimpat until after the trials were done.
And chances are you say you had the placebo?
Yeah, chances are I had the placebo.
Okay, so even if blood work changed throughout the trials, it wouldn't have necessarily been able to blame on Excopri.
No, but my doctor
Gotcha.
does want me to get blood tests every 6 months still, because Xcopri can damage your liver. So you gotta just make sure you're doing good.
That makes sense. All right, sorry for interrupting.
I got another post here. Well, it says having kids while epileptic. 29-year-old female was diagnosed with epilepsy earlier this year. Before the diagnosis, I was anticipating one day in the near future having kids with my partner. I always thought I'd have one or two before my mid-30s. But then I got the diagnosis after years of my symptoms being brushed off by doctors as anxiety. And now I'm second guessing whether having kids is even in my best interests. I've been seeing my brother and friends with newborn toddlers, and I'm worried that not only would a pregnancy be hard for me, but the newborn phase sounds like it would send me into a seizure with how little sleep new parents get. I normally get focal awareness seizures, often clusters, but have had two tonic-clonics in the past year, which is what I finally got my diagnosis for. I'm wondering if others have been in the same boat as me and decided to have kids, how it worked out, or if you decided to not have the kids after the diagnosis and why. I guess I'm looking for other perspectives because my boyfriend is confident and would like all of it to work out, but I have my worries about my health and whether that will be negatively impacted by my ability to be a mom. I cannot be a mom, unfortunately, or it might be fortunately. Yeah, fortunately, I can't become a mom, but moms, I think we got a few moms up here today. Um, hmm.
I'm positive the tubal ligation was voluntarily performed on the second C-section because I didn't want to have any more children on, because of the epilepsy. I didn't like how I was having more seizures, and it just wasn't conducive to, raising the family and getting pregnant again. So the epilepsy did have something to do with my decision to not have any more children, but it definitely didn't stop me from the first two. I mean, when it comes down to it, children do sleep, especially in that nice newborn stretch of the first few months. There was 12 months for both of them, and it's not about not getting sleep, but get it when you can. So if that tends to be a trigger, then make arrangements. It might be even more important to have somebody checking in, cameras, whatever support system that you feel comfortable with. You can definitely make arrangements. You're pregnant for a long time before the baby actually gets home. What do you think, Toaster?
I wasn't diagnosed until after I was already pregnant, but I did want a second child. That didn't end up going anywhere, but I did decide to have one. I decided that, well, you see, my dad has a neurological issue too. We have no idea what it is, um, but he gets migraines, massive migraines, and for a long time he wondered, is her epilepsy because of me? And blaming himself, and finally he just asked me. And the thing is, I may not have gotten my epilepsy from him, and if I did, so what? But I got the strength to live through my life from him. I got how to live and all the little things that make a person, if that makes any sense. So kids want your presence most of all, no matter what form you can give. They understand, they roll with it. When I tell Jeffy I need to lay down, he goes off and he does something else. It is possible.
And since you weren't diagnosed when you had kids, how was that?
I had at least one seizure during every pregnancy, but they went unrecognized. In all reality, I was diagnosed in 1968, but the clinical diagnosis didn't come until 2007. So my kids were born 82, 84, and 91. My last pregnancy, I seized during the delivery because my son decided he wanted to stay with mommy and he would not come out. His chest and shoulders were bigger than I could, and it was too late for a C section. And the things that they had to do to me are unmentionable and put me into a seizure, which they said was the best timing because the doctor could reach his hands up in there and pull the baby out. So I'm glad I don't remember that part, but I do remember them dislocating my hips to open the pelvis. So that's when I said, okay, no more. The marriage broke up then, and I had a tubal ligation because I said, I never, ever want to do that again. I love the three kids that I have. I'm proud that I brought them here and that they did the best with their lives. And I'm just happy to say I'm the one that brought them here. But no, after the third one, no. I knew. And it was one of those weird things. It's like we know there's something wrong. And when the doctors keep telling us, "Oh, you're fine, it's nothing." And then they see those things and they still don't diagnose you. I had an obvious epileptic seizure during that delivery, and they ignored it. They didn't report it, they didn't start treatment, they didn't do anything. and that was in 91. So, they said, well, the
That's how I
stress,
got my diagnosis.
yeah. And they said, well, the stress of the delivery, this, that. And I'm like, I don't get it. Okay, you're telling me I had some sort of seizure. I was told when I was a kid that I had epilepsy, so I don't know what's next. And it took a couple more decades to get there. But as far as having kids, I guess it depends on your epilepsy, your medication, the support that you have. Um, but yeah, it wasn't so much the newborn phase that got me, it was the toddler phase. Okay. How many times I was tempted to duct tape my kids to a wall. Okay. We'll just leave it at that. My daughter's sitting right over here. She was jealous of her sister's curl because Natalie has perfectly straight, beautiful silk blonde hair. But her sister has these little waves. And I think Natalie was they were maybe 3 and 1. Okay. And all of a sudden, the baby comes crying. I didn't know what happened. And there's Natalie. This is mine. I saved that little curl for decades, okay? Just to keep reminding her that you were so jealous as a child that you cut your baby sister's hair off, okay? It was not the newborn phase, it was the toddler phase. And then the teen years. I don't know how I got through that with 2 teenage daughters. Um, yeah, I don't know. My son was the one that witnessed more of the trauma from the epilepsy because it had ramped up just before that official diagnosis. And the hardest part was mom didn't come home. Where is she? What's going on? And after a few times, he figured it out. Just call the hospitals. Just call the hospitals before we freak out because if they didn't call us, um, whatever. And that's how he would find me. And that's traumatic for a kid. But for those reasons, I would hesitate having kids if I knew it was going to be that hard on them. And this hard. I mean, my daughter watching me yesterday morning, I was so sick. I have not been, it was like food poisoning sick. I was like, what did I eat? What did I do? I'm looking at everything and I'm like, oh, it was the weed. Okay. I'm okay. I did that to myself. And my doctor agreed, but he's like, you don't have to stop taking it. Just be careful. This pain's going to go away. Just be careful and do not mow the lawn again. And I'm like, I have somebody's got to do it. He's like, well, how long does it take you to do your lawn? About 2 hours. How much of a lawn do you have? About a half acre. Oh my God. Do not do that. You're not going to be doing anything until fall. I said, good. I'm looking forward to picking up the leaves with that mower. Okay. I don't have to lift a rake. I just have to put the bagger on my mower. I'm happy with that, you know. But, he's like, no, no. And I would highly recommend doing something where you're not using that left arm for at least 6 months. Not like that. And I'm like, well, okay. Okay, I'll do my best, but I don't want to re-tear that tendon because then, who knows. But my epileptologist was lecturing me about mowing the lawn because he's like, well, what are you going to do this week? What's your plan? And I'm like, well, I'm doing this, this, and this. He's like, no, what else are you doing other than laundry? Well, I have to mow the lawn, but I'm going to wait. No, you're not. No, you're not. Uh, I probably will. I'll get what we used to call them necker knobs. It's the spinner that you put on the steering wheel, and I'll put it on the left so I don't have to use my right arm. And I'm like, I can do that. I can do that. But yeah, But as far as having kids, if I knew it was going to be this hard, I wouldn't have. But I'm so grateful that I have these wonderful people in my life, and it was fun. But had I known, I think I would have reconsidered. I mean, my first pregnancy, I think I was just in my second trimester, and my husband worked second shift. So he came home around midnight and found me on the stairs, face down. And yeah, and it was like he just kind of he took care of me, but we never really told the doctor. We never said anything because who knows. But I would be very careful. Um, yeah, especially with medication. You don't know what that can do. But yeah, I would know what kind of advice, to give. It depends on the every individual is different, you know. I mean, yeah, I can still mow my lawn every now and then, but I don't think I'd want to put any more kids through this.
Just drop it and stop thinking about the lawn for a while.
I can't. I'm out here looking at it and it's like, oh shit. I'm seeing things. I don't want these dandelions going to seed or the crabgrass because that's what I'm trying to get rid of. And you got to mow it to get rid of that. So, ah, you know, it's my fun.
I'm sure you'll come up with a plan that is safe for all your limbs,
I hope
and
so.
as in somebody else helping.
Yeah, I hope so. We'll come up with something safe. I think the necker knob is yeah, the steering wheel spinner. I couldn't find it on Amazon because all I'm thinking is necker knob. And I'm like, whoa, that definitely dates me. Okay, but yeah, I'm gonna put that nifty spinner on my tractor steering wheel.
There you go. You're
And
smart enough to come up with it.
you said with the thing about your daughter cutting your other daughter's hair. My daughter did that to my son, and he had dreadlocks, and they were like maybe like a foot long.
Oh,
Yeah, she was cutting them, and then she took them to her mom, and then her mom said, "Where'd you get those from?" And she was like, "I got those from my brother." And she said when she started walking down the hall, she sees dreads on the floor leading to the room he was in.
oh no. Like he
Yeah,
was like he was running from her.
they
Um,
were like 4 and 5. So she said they were playing barbershop, and that's up.
oh no. Cut off
Yeah,
his dreadlocks.
he's been wanting them back, but it's such a long process to deal with it. When you're born and just get them going, it's good. But
Yeah, yeah.
start over
That
now at 13, 14. Sorry. Um,
oh, I know. It's funny what kids will do when they're young like that. It's like yeah, playing barbershop. No. She wasn't playing barbershop. She wanted the curl. She wanted that. And still, I mean, I have the same hair. I can curl it, I can style it, and an hour later, you can't tell unless I use a half a can of hairspray. And it's just not worth it because, God forbid, I smoke a cigarette, my head's going to go up in flames. I'm not doing that. I did that in the 70s and the 80s. I don't need any more hairspray. Okay.
um, Another thing is like you guys didn't worry about the whole time. You guys didn't have that worry that I could fall at any moment.
Didn't have time for that.
Yeah. I didn't even think about that. And I mean, I'm thinking about it now because my neurologist just made a big issue of it. Um, but I didn't think about it then. I mean, I fell up the stairs, I fell down the stairs. I blacked out in the kitchen. I had some strange things happen during my pregnancies. And, I had a seizure in a chiropractor's office because I was in so much pain. We thought, okay, we'll see if we can fix this. He did the adjustment. I'm laying on the table and my right side went rigid. And he turned, and he looked and he told my husband, he said, she's having a seizure right there. And yeah, yeah. And it's like, I've been having them all my life. They just got more obvious and easier to diagnose later. So, yeah. But I'm more worried about falling now and after my surgery. That's if I fall on that shoulder, it's over. It's I'll be like Jeff. I'll be getting a shoulder replacement, and those are the most fragile, complicated replacements for a joint.
You got a
And
body cast.
I don't know what they do. Do they? I don't know. Please don't say that, Pookie. Tell me you're joking.
I
Okay.
don't know what they do.
Yeah. No, my baby boy was in a spica, a body cast when he was 5. I don't know. Oh, yeah. No, I'm not going to think about that yet. We're going to fix it. I'm going to be fine. Therapy starts 2 weeks after surgery. I'll cry. I'll scream. I'll complain, but I'll get better. Much better than this. Ooh.
Angel, did you have something? I seen you with your hand up. I'm sorry. We went into deep conversation.
Oh yeah, you asked a similar question, but I was just gonna ask, with the pregnancy for the mothers, like, was it rough with the medications, even though, like, if you were on Keppra or lamotrigine and stuff like that, that was supposedly safe for the babies, like, was it a rougher pregnancy?
I didn't believe them, so I took less meds. The first pregnancy was a carbatrol extended release. I just took half the dose. I think they had prescribed. It was like 100 milligrams twice a day, and I went to half dose. No complications or side effects in a 14-year-old. And the second pregnancy was on Keppra and a benzo. I got off of that small dose of Fycompa, I think it was, immediately, and that would have been probably 8 weeks or so into the pregnancy. Had a couple bad ones because I, pretty much stopped cold turkey, and that was just a bad idea. But other than that, it was down to 250 milligrams of Keppra twice a day for the 10 months after that, and so far no developmental delays. He's 4, and so far so good. Definitely felt
Was
like the
there
medication wasn't doing shit though.
was there a specific seizure? I mean, specific pregnancy where which one did you have more seizures having? I mean, pregnant with?
That was my third.
The ones which I'm on.
Your
Yeah,
third was the
Yeah, I
worst?
think it was.
Yeah, it was my third. I was 30 years old when he was born. So I was, I mean, they don't consider that a high risk. Um, but I think after, yeah, I think my brain was just trying to tell us something. And, it's like they couldn't knock me out to do what they had to do. So my brain did it. And, you know, but yeah, they knew it was an epileptic seizure because everything went tonic, and it's like, well, this isn't going to help. So yeah, a deeper cut and reach in there. When the doctor explained it, I'm like, you know, I had dairy farms in my family. And when you say something like that to me, it just totally creeps me out because there's things you got to do to cows when they don't complete their birthing process. And
I've seen it.
yeah, I'm like, moo. I just felt like I'm like, you literally had to reach up in there. And he's like, yeah, I had to get my hands between his legs and pull him out. And when we figured it all out later, he was post mature. So there's this stuff called meconium, which is their first bowel movement. And he had that in utero. So it was in his lungs. So his chest, well, his chest diameter was almost twice his head diameter. So we needed a little bit of help. And yeah, that was a scary birth. But I had a couple seizures during that pregnancy and then that last one. I'm not surprised. You know, that kind of stress. I mean, just thinking about it, I get the heebie-jeebies. It's like, oh my gosh. Um, yeah, I had to have a couple surgeries after that just to put me back together. Um, but hey, you know, I'm good. I, I made it. But I think it was the third one. The first one, that one surprised me more than anything. Um, and what I never will understand is how is it that medical professionals were watching this happen? They said what it was. They knew that I wasn't being treated and did absolutely nothing. So, yeah, in that decade of having kids, I would have thought that one of them would have said something. But, you know, things happen when they're supposed to happen. That's all I'm trying to believe, you know. But yeah, it was definitely my third. And that, I will never forget that one. He's my one and only son. And that's what I call him, my one son. And I'm so grateful he made it because he almost didn't. But yeah.
That's brilliant. That's brilliant. What you say?
About the seizures, with which pregnancy was worse? Do you know why?
The worst injury, fall down 2 flights of stairs, happened on a second pregnancy that ended in a miscarriage. The third one, though, definitely had more seizures throughout. But I think with Talia, I had one tonic-clonic every trimester. But with the third, it was two. It's safe to say it was twice as many. But they were less severe at that point because RNS was already in. So, you know, it was still progress.
I'm so sorry you guys had to go through that. I couldn't imagine. But one of these comments in the having kids while epileptic, one says, I was on 16 plus, oh no, I was on meds for 16 plus years before getting pregnant. I immediately went off them. When I found out, I was fine, seizure free for the next 3.5 to 4 years. Through 2 pregnancies, only several months after my second was born, did I seize again. I haven't been seizure free for more than 3+ months since. I quit driving 9 years ago permanently. I've been driving on and off for the previous 6 months, 6 years, and finally gave it up all the way. My kids have grown up knowing mom has epilepsy. They've seen me seize multiple times. They were in vehicles when I wrecked, likely due to seizures. They understand, and we figured out ways to get around without me driving. It's not easy. It's not been easy, but we managed. I certainly would never make a different choice. I think I would have made some different choices if I got to one back, but one more comment says, I'm also 29 and I wasn't diagnosed until I was pregnant at 26. Turns out that I've been having focal aware seizures for 10+ years, thinking they were panic attacks. When pregnancy sent me into 3 tonic-clonics, and now I've been diagnosed with treatment-resistant epilepsy. I would not change anything about having my son, and it was the best choice I made. Though I really, really pissed me off epileptologists by breastfeeding, pumping for 8 months and refused to stop. But it was really important to me. I have an extremely supportive husband and village, which I believe helped a ton previously. Previously, I personally would make an appointment with a high-risk OBGYN discussing things. They can be extremely helpful. What is an OBGYN? That's a long abbreviation for something.
Please tell me you're joking, Pookie.
Is it like LOL, 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 LOL?
Are you
You don't know
joking?
the abbreviation for the lady doctor?
Oh, that's abbreviation for a doctor?
Yes.
Obstetrician gynecologist.
I thought it'd be like DR and then some other stuff, but say that again. Opposite what?
Obstetrician gynecologist.
Oh, okay. I think I heard of it before. Um, yeah.
The obstetrics part is all about pregnancy, childbirth, and postpartum, and gynecology is female reproductive system outside of that. So diagnosis, treatment of all the lady parts. So the thing that Allison says now in the chat that her son has autism and he's on Dilantin, and she's saying that she doesn't know how she can trust the doctors, just trying to reassure her that it doesn't make a difference. But I would have a problem trusting the doctor too, especially just based on you know your child best. If you see, oh, okay, she was on Dilantin during the pregnancy. Okay, I misunderstood. But yeah, I mean, you know your child best. If you see something that is noticeably wrong or they're falling behind and not meeting those milestones that you're expecting, don't give up on getting a diagnosis or establishing some kind of therapy or something they can go to. Because doctors might try to blow it off, but you don't have to.
Not only that, but remember, kids ebb and flow when learning anything and everything.
I got something else. It says consistent seizure once a month. Hi, team. 25-year-old female, and I've had epilepsy since high school. I was on Depakote first, which was really successful. Stopped the seizures. I didn't have any for like 7 years. Since I'm at an age where I started thinking about pregnancy, I've been experimenting with non-harmful drugs. I've been making some progress, but every time I think of I'm improving, I get a seizure. I just had one. It is also a consistent one, once a month. I'm wondering what is happening in my brain during all the days that I don't get a seizure. Is there a reason why consistently it's once a month and not like on fatigue or other reason basis? Why is my seizure on my cycle? I also read the menstrual cycle could play a part too. Thanks a lot. I almost forgot it was a female until she said cycle.
Catamenial epilepsy.
Well,
There you are.
it's very nice that Pookie is not gender biased. I appreciate that.
Right now, my memory will come back. I've been through this 6 times. I'm sure I'm gonna remember some of these things. The OB, I
No,
thought it was just
no, I
OB,
wasn't
but
saying
then
that in a bad way. It's
yeah,
good.
I was
It's
thinking
good
some of these things I should
that
know.
you're not biased. I just want to put out there that there is a ton we don't know about epilepsy. They don't know jack shit about a lot. So there's that. And there's even more we don't know about women's stuff because no one cares. So there's that. So where they meet, there is, I am sure, very little. So who knows?
Yeah, I can agree with that. It seems like doctors never really know what to test for to even start on figuring out why something happened.
Yeah.
But
But I'm
there's taking
thinking,
notes.
yeah, because I don't believe I ever experienced catamenial epilepsy. But who do you talk to? Do you talk to your epileptologist? Do you talk to your gynecologist? Both? Um, because that might include some hormone therapy. So, how I guess what I'm asking is, what do I tell people when they ask, what do I do? When you discover that you're having these seizures only once a month in a certain part of your cycle, that says a lot. And my daughter has a studio for women only, and she's a strength trainer. Uh, I mean, everything, weightlifting, functional fitness, which is what keeps me moving. But she studies all of those things. And, we were talking about the raging hormones during our cycle. And there's times, some women will have more seizures during a certain hormone level. So tracking that is one thing, but who do you talk to? Do you just tell your epileptologist? It's like, yo, I noticed that, during ovulation or during this phase, this is when, you know, I don't know, ladies, who do we talk to?
Whenever I mention it to the neurologist, they say just be ready. Don't plan on going out for those 3 or 4 days a month. And that sounded so, yeah, I think that I heard that from a male and female neurologist. So this is another example of patients having to take initiative for their own
Yeah,
care and well-being and bring it up to the medical professional who's supposed to know more about hormones and what they can do and which ones to track. And, not to mention, who knows if all this like sodium and potassium and things disappearing from the medications might not make some of those other hormones pretty extreme. I mean, I think we can all agree it's about balance
right, right.
between, blood levels and hormones and everything. If anything is out of whack, then we definitely have a lower threshold for seizures.
So I want to go back to something. I did. I have heard of um, OB. I thought it was just OB. I've been told OB. I've heard that a few times, but I didn't know what the GYN meant. I've heard people say I'm going to go to the OB. So you got me there, Reese. I should have known that, maybe just the slightest bit. But I've always heard it just be I'm going to the OB, not the GYN, and I still forgot what the specifics were to that, what you said earlier. It'll come to me, maybe, maybe not. Um, but yeah, sorry to keep this in the catamenial part, but it made me want to ask something else. Um, about the time of the month thing, is it like specifically like you guys are stressing or you guys losing too much blood that time of the month, or is it just it's just I'm having this time of the month? That part I didn't understand. Like what specifically causes that? Or is it for everyone who has to go through that time of the month? I might need a doctor. A female doctor. Come on, females. I really don't understand it. Like, does everybody go through this? Well, I
No,
mean, female wise.
no,
So it's like specific. Uh,
yes. It's a unique form of epilepsy, just like any other epilepsy, like Dravet's or Dunes. Um, it's just a very unique form of epilepsy. And I remember Dr. Rovner, my other favorite neurologist, he said it's literally a phenomenon. And it doesn't always occur during menses when you're bleeding. It depends on the part of the brain that's affected by the particular hormones. And the hormones for a woman change almost on a weekly basis during the month because you have like the post menses where the uterus is rebuilding that lining, and then you have ovulation, and then you have what's called the egg drop. It's I can't remember the name of it, where that egg goes through the fallopian tube, and the hormones are different so that that egg can be fertilized. So, and then the hormones change again when it isn't fertilized, and it's time for you to shed that lining and go into menses. But not everybody has the seizures at the same time. Some will have them on ovulation. Some will have them on, during menses, or during that. And I know there's a name for it. Natalie would kick me, but during that time when your uterus is rebuilding that lining, um, all the hormones, your hormones are constantly changing, And it just depends on what part of the brain is being affected by those hormones. And it makes it that much more difficult to diagnose and manage because it's so multifaceted. But catamenial epilepsy, like you said, Kate, they just say, just keep yourself safe for those few days. That's really all you can do. Um, but I want chocolate. But yeah, I saw that chocolate cake. I want chocolate. But yeah, I don't completely understand it, but I get where it's coming from because my seizures were more noticeable during pregnancies than they were any other time. Um, and I started with just focal seizures that were almost unnoticeable, but during those pregnancies, and my doctors told me then, it's the hormones, you'll be fine, and they weren't going to put me on medication during a pregnancy for sure. But it's all based on the changing hormones, progesterone, estrogen, they're superpowers. And, you start, when they start changing, your brain responds. So if you're susceptible, yeah.
Did daughter tell you that some women can lift like superheroes during that time?
She can. She can. She's under
That's
five.
brilliant.
She's under 5 foot tall. I call her my tiny ninja because she
Oh,
did what do they call it? An Ironman marathon.
wow.
And just yeah, I still get goosebumps watching her jump over. I have pictures and videos watching her jump over this flaming column of yeah. She had to get a running jump and she's not even 5 foot tall. And she cleared those flames like they were nothing. And her dad was there and he's like, you should see these people watching her. This is the best part. I love watching this, but watching the people watch her because she is a tiny ninja. And I'm 4'10, I think she's 4'11, but she can deadlift twice her weight. And
That's
yeah,
amazing.
and she's a personal trainer. So she does it right and she can teach you how to do it right. And resistance training and weight training is a woman's best friend for preventing osteoporosis. So keep that in mind. And I can't lift much, but where are they? I do have tension bands, um, which I'm not supposed to use right now because that thing. But yeah, just something this simple and doing this, and I'm actually activating some of my pectoral muscles that are
Stop
supporting
it.
my shoulder. I'm not going to
Don't do
stop.
that.
I'm not going to stop.
If something snaps on camera,
It already
we're not going to be
did.
happy.
I thought I told you guys what happened when I went to see the surgeon. He said this is once in a lifetime. He ruptured the tendon because it was so frayed. His thumb went right through the tendon when he was manipulating it, and he just did one of these. He's like, all right, yeah, we have to reattach that. So yeah, I can't make it any worse right now. And
Talk about timing is everything.
the only thing that gets worse is I don't know if you can see the lump through my chub.
Yes.
See the lump?
Yes.
Because this bicep is no longer attached to my shoulder. It is only attached to my elbow. There are two tendons. I tore one and he accidentally tore the other. So that's when it was like, okay. And the muscle instantly like curled up. So that's why we're going to tape it to give the muscle a little bit of a break so I can keep moving that muscle because it has to be supple and flexible next week so we can pull what's left of that tendon back up, or we're going to have to take some of it from my hip. I don't want to do that. No. So, yeah, we also talked about the There's synthetic tendon and cadaver tendon. I have some of that in my knee. So we're ready for whatever. But I can't make this any worse. My rotator cuff is fine. The tendons are already popped off, Kate. It's already disconnected.
So cool.
That's why I'm like, so you're telling me I can't make this worse? Well, but you can fix it when I get there. So I'm still going to mow the lawn. And that was the orthopedic surgeon. But the epileptologist is like, no, you're not. I don't want you doing that. You shouldn't be driving anything. And I'm like, dude, chill. It's a lawn tractor. Well, okay, but I don't like it. But it's I think I know enough to be careful. I know when I'm feeling kind of funky. I've parked the mower a couple of times, cleaned it off as if I'm going to put it away because I'm not sure, you know. But after an hour or so, I'm okay. I'll go back out and finish. But it's been crazy hot and humid here and no rain. So the grass is barely growing. I could skip it until probably next week, Tuesday, and get it done. But yeah, I can't make this much worse.
Come on,
It's
you
all
guys
right.
just spray something for the crabgrass and please put it off.
Yeah, I was looking at that. I was. I have a half acre, Kate, and to put down what's called a post-emergent herbicide will cost me to do it myself over $500. I can have,
Ouch.
yeah, I can have, what's the lawn company, whatever, green lawn, whatever. They can
Yeah.
come in and do it for 7. So I'm like working this out with the homeowner. And I'm like, if you want it done, I'm going to have to ask you to get it done because, you know. So, but that doesn't stop it from growing. Um, so I still have to mow it. It's not a big deal. My daughter keeps saying, "Oh, I'll drive the mower." I think she's maybe gone 500 feet so far. She's yet to drop the deck. She hasn't done any of that yet. And she's like, I just don't feel comfortable. Well, neither did I. And I'm gonna make you do this just in spite. I'm gonna make you do this.
Well,
And we
whatever
have
takes place, you will save your receipts.
yes, yeah, whatever I do. But the crabgrass is gonna keep growing, everything else is gonna keep growing. I have to keep it. I take pride in my garden, but this year you can tell that I haven't been out there. My neighbors have even mentioned it's like, what is going on? Well, you see, I kind of messed things up for myself for this year, but I should be fine for next year. Um, yeah, getting more
Well,
attachments.
I took pride in my job, and they
Same.
haven't fired me, but they've completely squeezed me out, so I'm not doing anything that matters anymore.
Yeah.
So that's cool. I mean, I I didn't want this to just be a Reese complains session, but
You're in a safe place, love. Get it out.
Yeah, we're here.
they I don't want to give the specifics because this, goes online. But I'm not doing what I used to do anymore. They pushed me off the team, and now they're
Mm,
just trying to give me small projects so I have something to work on, and I'm just doing tiny things that don't matter, and I'm just feel like crap.
Yeah, I get it. And I don't want to make this sound dismissive, but hey, at least you're still working at some capacity. But I get it. It's like I want to be back to what I was doing, but I know myself, I could never, at least not now. I could not do what I used to do. And especially nursing. Um, yeah, I don't think I could have been doing that. But going to something different is as minimal as it sounds. A call center for when they were creating Verizon from Southern Bell and GTE. We had all those customers that had to switch over to Verizon. And we were giving away free cell phones, all this awesome stuff. And first I was customer service, then I was team lead, then I was manager. I moved up pretty fast, but now I don't think I could do it. We were, I know this is off topic. We were at Harbor Freight last week, over the weekend, and this guy came in with a product he wanted to return. And he was giving the cashier a hard time. And we backed off because we weren't going to leave the store and leave her without some support. And so we all backed up into the store just to hear this out and make sure she was safe. I commend her. I would have lost it. And it turned out that he purchased the item online. He wanted to return it. He got the refund and was told to return the product to a physical store. But he wanted another refund. And he was like, how could I have returned it if I still have the item? And this was his third attempt at doing this. And this woman was handling this situation so calmly. I was like, no way, no way. I would not be able to do that. I was so impressed. And I realized I was doing that every day. I was dealing with people who were screaming at me every day. Never fazed me then. But now, I don't think I have that kind of calm anymore. I was like, we all wanted to grab him and drag him out of the store. He was just being a total ass. But yeah, I wish I could go back to work, but I know that I can't. Um, and the closest thing I'll get to driving again is my lawnmower. Okay, so
But that is Anne's prime example of the perfect rationale, like way to still see the positive side, appreciate what you have accomplished and what you can look forward to, so you don't even have any time to focus on the negative and feel all those boohoo feelings.
yeah, been
Another thing
through
about
that.
those catamenial seizures, I don't think anybody ever told me until I asked the OB, if I'm living with another female, why do I have more? I feel like my threshold is lower when she's on her cycle. And they said, "Oh, you never knew that? When you live in the house with another female, that actually influences your hormones as well. Same thing, an estrogen progesterone thing.
Hmm.
So that's something that I think anybody with catamenial seizures should be aware of.
Wow.
Because, like you said, it doesn't happen a lot of times actually during menses. It could be any one of those other weeks throughout the month that,
Yeah,
just depending on what side is, what part of your brain is weak, might be more likely to have a seizure."
yeah.
I
I
got
don't
another
think.
question for the ladies. The ladies other than Anne, um, when she was speaking, um, being that she's a boomer, did she teach you guys? Did you learn anything when she was talking? Something you did not know that she said. Did you learn anything from an OG?
The different stages of menses. I didn't know the egg. I thought egg drop was like a disease. I didn't know that was part of what she was talking about. But hey, everything has to take place. So thank you for shedding light on that, and in a
Okay.
way we can all understand.
Okay, because I was thinking I learned a lot, but I was wondering if you ladies had took in anything that she said because I learned a lot. So Yeah.
This is
Yeah,
why I
no,
want my
I
daughter
didn't
here.
know
Yeah.
that either. So thank you.
Okay. Um, I got something here. It says newly diagnosed need advice on JME Kepra, driving restrictions and what comes next. 27 years old, and I was recently diagnosed with epilepsy after an abnormal EEG, and doctor suspects it's juvenile myoclonic epilepsy, abbreviation JME. But I haven't had a full evaluation yet, just the EEG so far, and they're scheduling an MRI before my next appointment to get a clearer picture. I likely had this for years, maybe 7 to 10 years, but I didn't realize the jerking twitches I was experiencing was a seizure related. I had frequent myoclonic jerks, mostly in my head, left arm, and left leg, especially when I'm tired. But I've never had a tonic-clonic grand mal seizure, and these jerks never happen when I'm waking up. They just started me on Keppra, not sure if the exact dosage yet, but everything I'm reading while online and side effects, especially mood and personality changes, has me a little worried. If you've taken Keppra, I'd love to hear your experiences, positive or negative. And if it had issues, how have you managed? For anyone with JME, do you go years without realizing your symptoms were seizures? Have you ever had tonic-clonic seizures eventually, or has it mostly stayed myoclonic? What medications worked for you, at least the side effects? What were your driving restrictions like in your state or country? How did you handle transportation in the meantime, and how long until were you at cleared to drive again? I live in a state I legally can't drive until I have seizure free for 6 months straight, and that's probably affecting work and family life. I work tonight. I work night shift, and reliable transportation is a challenge. My job might move me to the day shift, but I'm in limbo right now, trying to figure out how to manage everything. I would really appreciate your answers. Um, Personally, I don't drive or have JME. Um, yeah, I haven't had myoclonics that I've picked up on yet and put together the pieces. I've had some seizures that have some unexplained reasons that I got to talk to a doctor about. But so far, I was having focals and tonic-clonics. So, anybody else having myoclonics? I've had some jerks that were bad, but they rarely happen. I've thrown some grease across the room on accident. Yeah.
Anything that's happened on mine, I don't remember myself, so somebody else has to tell me that I was walking with something when it happened and that maybe didn't drop it, but it looked like that arm went out first and ended up throwing something. But I don't really have jerks outside of when the seizures already started or if it's a cluster.
I've been told to have jerks when I was younger, but I was already unaware. So, the only ones I can think of is when I'm about to go in the clusters, and yeah, I'm spraying the nasal already. I'm not waiting for them to start.
You can nasally
And
him yourself.
oh yeah,
Hmm.
trust me, Pookie, you do not want to experience 6 hours.
Didn't know that. I have some, but they expired in what's it called? May.
Yeah,
Had them for
I think
years.
I think they can refill them or
Uh,
something. I heard something. It's
Being
like
that I
they,
don't necessarily have auras or anything that picks up on me having a seizure, um, that's why it's still sitting here because
yeah,
I can't do it to myself. And
yeah. I think you can take them back and or send them back to the company or something like that. I was told something.
okay, yeah, I've had these a few years, so that's why they're sitting around. And did you have something to say?
Not really, but I was wondering if you have any rescue meds at all, like that somebody else could give you, or because I know you don't get,
Somebody like
or
who?
like even just an Ativan, but you don't even know when you're having your seizures. I feel lucky, right? Angel, I really do. I feel fortunate that I have a warning before those awful tonic clonics will hit me. And I haven't had one of those for quite a while. But yeah, I mean, do you have anything? Or, and would it matter because you don't have the opportunity to give it to yourself?
Right. I have nasal in, but you can't do it yourself when
When you're
Yeah.
out? Yeah, yeah.
hands
And
don't even want to do that. But I found some.
When
I was
I
reading
think it was
something
the
just
first.
a few days ago,
Oh, I'm sorry.
and oxycarbazine. Ever heard of that?
Oxycarbazine is one of the family of Tegatrol and stuff like that.
Why do I have
You must
it?
have-
It looks like it is available in an immediate release and an extended release form. So maybe that could be a, maybe not a rescue med, but that makes a difference. Depends on what kind you have and see if you can go back to notes from the visit when that was prescribed. That might tell you something.
I'm just wondering why I have it, and yeah,
check the date on it. Maybe you
oh,
were.
the September 2023. I definitely don't remember that. It says discard after 2024. I don't even know why I have this. Then some Kepra from last year.
Yeah, I would just discard the Tepra.
This one's from 2023, and this one's from 2024. Yeah, they both expired. Can't you take those to like CVS where I got them from? I think I seen this bin that said something like return pills or something, but I'm not sure.
Yeah, yeah, they have those bins there. Or you can also take them. I don't know because they told me when the bin is full, you can also take them to the police station.
I don't like going to the police station, so that's
Yeah,
out.
I'm like, I'll just wait till the bin is empty next time I come to pick up my meds.
Yeah, that is on my favorite list.
yeah,
Um,
we have them any hospital that has a pharmacy, which means every single hospital usually has a drop-off bin. So I that's what I do here. And a couple of years ago, I was hanging out with my neighbor and I ended up having a seizure. But before that seizure, she had all kinds of stuff she wanted to get rid of. And the next day, I was going to the doctor who was at the hospital. I'm like, well, give them to me. I'll take them. She had hydrocodone that was like 8 years old. I'm like, just flush them. But okay, I'll take them. So I had them in my pocket. When I had my seizure, the
Oh,
EMTs are calling me Gabrielle. And I'm like, what the heck? I'm coming out of this seizure and I have no idea who they're talking to. And well, why did you have this medication in your pocket? And I'm like, oh my gosh, that's not mine. And they were like, well, we're going to have to report this. And my friend said, this is what happened. She's going to an appointment tomorrow. She can put them in the drop off bin. They took them for us. I'm like, I'm not going to use these. I can't take these drugs without the help of an epileptologist that I trust. Um, so grateful now. But they thought that she was giving me her stuff and I was abusing the drugs. No, I was going to take them and throw them out. But they did it, whatever they did. For all I know, they went home and went on a bender. I don't know. But I know I wasn't planning on taking them. But our hospitals here all of them have a drop-off bin. So I don't know why you can't just take them to pharmacies here. But Pookie, you got lots of drugs you haven't tried.
Yeah, I got a lot of pills over here because
I see that
I
stacking
have
them up
problems with my hip as well. Yeah, from the car accident,
from the
from the
car
hip.
accident. Yeah, dude.
But I don't like taking pills, so I take the ones that I have to take, and these are just stuff that wasn't mandatory. Pain pills and sleeping pills that don't work, and I don't even know what Prilosec is for, but um, yeah,
Holy shit! It's time to get rid of that.
right. Ibuprofen. I got so much ibuprofen. I know. I hate taking pain pills, so
I don't.
Prilosec is
I
for
don't even.
heartburn.
I just fight through it. Oh, that's what they gave me that for.
I don't even touch pain pills with my seizure meds.
These.
Yeah, and I have to. I have to. Next week,
I know you have to.
yeah,
Yeah.
I had
Okay,
my
yeah, these are still
toenail
good pills.
had my
Thanks for
toenail
pointing that
pulled
out.
out, and
Mm.
my doctor gave me hydrocodone for the toenail, and I'm like, I don't know about this, and yeah, so I had to call my epileptologist. I'm like, how do I do this? Because this pain is real. Okay, it's like dropping a can of crushed tomatoes on your toe. That's what it feels like. So I had to have some pain medication, and I didn't want to take it, but I needed them. And I have to confront the same thing next week. So we're talking about what kind of pain medication would be better than hydrocodone or safer. So, but yeah, I hate taking pain meds. It's like, just get me a bottle of bourbon. It's just as dangerous, but I'll enjoy it more. I'll just be happier.
I can just lay down and smoke, and it usually goes away.
Can't
Because
I can't do that on Xcopri anymore.
you missed it last week. I
Oh,
was going through some issues.
yeah.
Yeah, um, I had to get up and walk away several times.
Oh,
I couldn't stop my eyes from watering like I was crying. Kate, explain because you were here when I was going through that, right? Um, Brandon, see you. I couldn't do it. I felt like giving up.
Yeah, so not to remind everybody, but I can't give you any specifics on like how many times you walked away, but that's definitely what started catching our attention was when your expression. Your expression just didn't look the same. And that's when you did kind of come back and tell us that something happened and we were all just watching out. Everybody was typing in the chat, and I think Sailor Mom was probably the first, or maybe Sia was the first one to actually call out to you during the meeting, but you're
I think
doing
when
with
she
all the
asked me that, am I okay? I said no. Um,
yeah.
yeah, I finally kind of understood what that impending doom feeling was. That's what I think I was going through. It was like,
Oh,
feel like something is going to happen. Why is nothing happening? And why do I feel like this? And should I leave? And I was going through so much at the time. And I think I know what an aura is. Is that what an aura is? Because I don't know what I was going through.
it
And
sounds like it.
yeah.
yeah, I felt nauseous and I was just like, what is going on? I kept going out of there to go figure out what is going on. And I don't know why I even left the room, but I was just walking in and out of the room. um, but
Yeah,
I went and
same
got
here,
this
Pookie.
and yeah, I was like, let me make a call. Let me go get a pen because I didn't have weed and this helped. And as soon as the nausea went away, I was back. Go ahead, Toaster. You were here. Can you explain? I think you were here. You're on mute.
Mute toaster.
Oops. That was an accident. I was on Reddit. I wasn't in the chat that day, but I remember you saying impending doom. It's like the sky, earth, universe, all of its array is going to just go poof. And worse, it's going to come down on your head. That type of feeling.
Yeah, it felt like something that was obviously going on. In the part about the obviously going on, I think I was more irritated that I could not figure what's going on. That was the odd feeling, like what is going on and not knowing what is going on. And I started sweating and having hot flashes. I couldn't sit here
That's
anymore. I kind of
hugs,
walked
brother.
away.
Hugs,
Yeah,
little
I was
brother.
getting all clammy and stuff, and I was like, "Yeah, something is going on. Time to walk away."
That's when you need a rescue med, like Ativan. That's when you pop an Ativan under your tongue,
Yeah.
bro. Even if it
Or you
isn't
pop
a
your
seizure.
nasal.
Yeah, yeah.
I think
That
the weed
very well.
helped. The weed did it for me.
That's good. That's good. I have to be careful. I'm still token up, but oh, I
I
don't
don't have any problems with weed and Xcopri.
know. Well, I'm
No.
still titrating.
And my
So,
neurologist does know.
yeah, so does
So,
mine.
yeah,
Yeah.
okay.
And he's like,
Mine is
well,
fine with it.
yeah, he even knows I use psilocybin. And
Oh,
yeah, very curious guy. He's like, I want to know more. So I gave him the links to the people who helped me with all of this. And they're called Unlimited Sciences at Johns Hopkins. And they're sponsored by Realm of Caring. And they study cannabis and psychedelics and how they can be used. So, it's
that's
like,
awesome.
trust me, I will not take too much of anything, especially after yesterday. And he just started laughing at me. And I'm like, that's not funny. Okay. And it just made him laugh more. And I'm like, okay, I'm hanging up now. And this is one of those things where it's like I feel so much better with this doctor because he's real. He said, well, you do what you want, but I would definitely avoid that pain. I'm like, I guess I have to choose between the pain. Do I want my shoulder hurting or do I want to be puking? Um, yeah, yeah. I don't want to throw up like that again. Oh God, no. The worst hangover of my life. Okay.
Please take your medication as prescribed or whatever works for you. We're not doctors.